Premier, are you proud of our health system?
I'm very proud of the workers in our health system. Our nurses do a terrific job. Our doctors do a great job. Our AMBOs do a terrific job. And we've got a health system that has to face enormous challenges with increasing population size, ageing of the community. So our task is...
Respectfully, both of those things wouldn't be a shock to you.
No, they're not a shock to us. And that's why we as a government, in the last budget, for example, put a record level of funding into health, $14.3 billion, $2 billion higher than when we came to government. We've got a record level of funding for our hospitals, a record level of funding for our ambulance services. We are funding our health services. And indeed, with regard to capital works, we inherited a situation where there was a problem with a lack of investment in capital works in our health services. And we're spending over $4.5 billion as we speak, upgrading hospitals, building new hospitals and building new health facilities, whether it's the $630 million Bendigo Hospital, a great new hospital for that region, whether it's $448 million on new hospital facilities at Box Hill, new hospital facilities at Frankston, Ballarat, Bendigo, Northern Hospital, Werribee Mercy Hospital. We are investing $4.5 billion upgrading our health services across the state.
We thank you for all that, but an 85-year-old woman, a Chelsea nursing home, suspected heart failure, remembering her age is 85. 7 hospitals were either visited or checked out, all of them either on bypass or did not have the facilities to take care of this woman. She got to the 8th hospital. They were going to admit her, but they ramped the paramedics there for an hour, so she had to stay in the back of the van for a further hour. It took 3 hours and 44 minutes, I believe, from the time the paramedics picked her up before she got to bed. With everything that you had just said about investment into the health system, what do we say to the family of that 85-year-old?
Firstly, I say sorry to that 85-year-old and her family. That situation is not a good situation. The background to it is they didn't go to 8 hospitals. My understanding is that they went to the Frankston Hospital, which was on, when they just about arrived there, it was put onto bypass. And then they went to Knox Private and were bypassed once again and went to Maroondah. So the 3rd hospital, they were admitted at Maroondah, and then of her own choice, the lady and her family then relocated her back to a private hospital at Frankston. So I can advise that in the last quarter in Melbourne and Victoria, that all our hospitals met the bypass benchmark. In other words, we're actually doing better with less hospitals on bypass than under the previous government. We're investing more money, a record level of funding into ambulances. Mm-hmm. We do have a particular problem at Frankston where this originally started. And the big problem at Frankston is there's been a lack of investment over the last decade in emergency department at Frankston. And we, I think 2 budgets ago, allocated $40 million for upgrading the Frankston Emergency Department, and in the most recent budget another $36 million for upgrading extra beds at Frankston. So we've got a $76 million capital works program at Frankston. These beds can't be built overnight. So we've got tenders out, we've got people out there building a whole new emergency department at Frankston, because we know Frankston's been a particular problem with ramping of ambulances, with ambulances on bypass. So we're investing $76 million to upgrade facilities at Frankston, more beds, better emergency department. We're also investing $25 million at the Northern Hospital for a new emergency department, because again, Northern Hospital is an area where we've had some difficulties.
We've had a lot of problems in the Sunbury area with paramedics over the last couple of months, but these things are not new problems with the paramedics. I mean, Ambulance Victoria might well turn around and say we're in an industrial dispute and this is a campaign. Do you believe it's simply a campaign from the union, from the ambulance union?
Well, let me not get into the issue about an EBA. There is an EBA going on, and we've made an offer of 2.5% to the paramedics, and above 2.5%, it's based on productivity trade-offs. Just the same as we've done a positive deal with the teachers, we've done a deal with the doctors at our public hospitals on that same basis. And we offered to, or Ambulance Victoria offered to, with the union, to go to conciliation through Fair Work. The union knocked back that offer. I would urge them to go to that conciliation process. But let me say...
Well, just before you move on with that, the teachers' dispute all but killed off your old boss. The same thing could happen here if these things continue for you.
Well, what I'm saying is that we have got a very good offer on the table with our ambulance paramedics. We respect the work they do. They are highly qualified, highly skilled, highly dedicated people who do a terrific job. What we are offering is 2.5%. They can have that tomorrow. And if they want above 2.5%, then we look at productivity trade-offs. And that's exactly the same as the teachers have signed up for, exactly the same as the nurses have signed up for, the police have signed up for, and the doctors in our hospitals have signed up for. So, and going to a conciliation process helped significantly in getting that deal done for the doctors in our public hospitals. And I would urge them to take up that offer. But in the context, we're putting $662 million into Ambulance Victoria, 18% more than under the previous government only 2.5 years ago. We've put on over 350 new paramedics since we've been in government. So we've got more paramedics, more funds, more ambulance vehicles, more ambulance stations. We are investing significantly in improving the ambulance services and giving them the capabilities of doing their job.
So is there something getting missed in the middle here that we don't understand? Because the cases are there, the cases are real. I mean, I don't think we're really here disputing the case, are we?
Well, the situation is there's over 800,000 calls to Ambulance Victoria each and every year, and those cases are dealt with efficiently and well. In that
they're not, Premier, respectfully,
well,
they're not. Not all of them.
800,000 cases. There is always going to be one or two cases that perhaps have some issues, but we're addressing those issues. And the main issues are, and the issues continually raised, is so-called ramping, or the transfer time from when an ambulance arrives at a hospital into the hospital bed. And a lot of those are associated with a lack of investment or failure of the previous government to invest in emergency departments. That's why we're spending $4.5 billion building more beds in our hospitals, building new emergency departments, building more emergency cubicles at Frankston, at the Northern Hospital, at Box Hill Hospital, at Bendigo Hospital. That's why we're actually doing those investments that can't be built overnight, but we're investing in new emergency departments, bigger emergency departments, more hospital beds, so that our ambulances that we're also investing in terms of more staff, more ambulances, when they get to the hospital, can unload those patients and get those patients triaged as quickly as possible.